Okay. As Jed said, I was awarded a global STEM professorship from the Hong Kong SAR government the second week that I arrived in Hong Kong, actually. Last January 2024, but the application was actually written and submitted while I was still based in Manchester before I actually came over. So I'll talk a little bit more about that process as we go on. So I thought it would be interesting to talk a bit about what a STEM discipline is. Many of you on the line probably know what a STEM discipline is, but some of you may not. Or if you do, you may not have actually linked a STEM discipline with nursing. And we're going to have a look at how we can attach nursing, the nursing profession, to STEM through education, practice, and research. And I'll give a couple of examples on all of that as well. But I think one of the key examples of how we can look at how nursing can fit the STEM discipline definition is around digital and technological innovation. And I think that's something that's just become part of our everyday life as a healthcare practitioner. Many interventions that we develop and implement into practice are digitally enhanced. Most of our hospital records are now electronic, and we collect a lot of data from patients. So that provides a really good opportunity for nurses to take a lead in that and to create a developed narrative that helps us define who we are and how we relate to STEM. So I'm going to look a bit about what STEM is, how nursing fits the definition, but why? Why is this an important issue for the nursing profession? And what is it about STEM that tends to set those degree programs and people who are working in STEM disciplines, sometimes sets them apart from others? And we're going to have a little look at some data that's come out of the USA around that as well. But I don't think we can talk about how we define ourselves or not as STEM without really looking at the nursing profession itself and our history, our image, and the narrative that not only what we use to describe nursing and what a nurse is, but what other people use as well, and how this can have negative or positive implications for nursing practice. And I think at the center of all of this talk is really the engagement that I've had in looking at nursing as a STEM since I arrived at PolyU. And we've got a couple of exciting developments that are happening here in the School of Nursing around nursing as a STEM discipline that I'll share with you as well.
Shared? Been shared. Right?
What's wrong?
Been shared. Yeah. I can see the share. Okay.
Okay, talking about digital innovation, we're just checking a few technological issues here in the back room. Okay, so what is STEM? Well, it's an abbreviation or an acronym that's used to classify science, technology, engineering, and mathematics. So it's actually a term that's been around for a very long time. And the first official documentation of the acronym STEM was back in the early 1990s at a mentoring program held in New York. But then not long after that, in the States, the National Science Foundation, the NSF, picked up this as a really, a cool acronym that can capture young people in particular, STEM, science, technology, engineering, and mathematics. And of course, it's just been classified as STEM ever since. So STEM courses or programs of study refer to any educational program, particularly at the undergraduate level, where one or more of those four core disciplines is a part of that program. And I want you to remember that. So the definition of a STEM program is one or more of the four core disciplines being included in that program of study: science, technology, engineering, and mathematics. So STEM courses are very well known for being innovative, teaching students how to be innovative. It's all about solving problems of today, solving real world problems. And it's really helping to develop people to go into industry and to go into technology. But at the core of a STEM program is critical thinking and analysis. Again, I want you to remember that point as well. So the most popular STEM programs at the undergraduate level, and this is from international literature, is computer science, data science, and various branches of engineering. And of course, engineering is a subject that's very, very strong here at PolyU. But all of those are classed as consisting of a STEM program. And students can have the option to major in biology, chemistry, computer science, and so on and so forth. So why is this important to acknowledge? Well, there's a number of implications when your program of study is classified as one of the STEM disciplines. It has real significant implications for the funding that can flow through into those programs from the government. So in the USA in particular, funding is quite often ring-fenced for programs that meet the STEM definition. And it's the same in the UK and in Australia as well. And you'll often even hear prime ministers from the UK and Australia even mentioning that they are trying to attract more students, and they'll also add in more women into STEM programs. And they really do put money into trying to develop these programs. So there's money implications for teaching. There's also money implications for research. A lot of research funding at the government level across many countries is ring-fenced for STEM disciplines. So at the moment, nursing misses out on quite a bit of funding, both for educational purposes, but also in relation to research, which I think is a real shame because actually a lot of our research does touch on all four parts or all four letters within the STEM acronym. Now, in some countries, again, in particular the USA, if your program, undergraduate program or postgraduate program, fits the definition of a STEM discipline, then it has real implications for students being able to get visas to come and study in that particular country. And quite often with quotas of visas in certain countries, they will be ring-fenced for STEM disciplines. The same with also people getting visas to go and work as academics at international institutions. Again, quotas can often be ring-fenced for those departments that fit the STEM definition. So there's another way that nursing currently misses out is access to government policy in relation to visas for both work visas and for student visas. And I think it has real implications as well for nursing being able to attract school leavers. So STEM is a very, very common term that is used in schools. It's used by workforce counsellors, career counsellors in high schools. It's used by teachers in high schools, because the STEM disciplines have been very, very clever in marketing their courses as a STEM discipline and getting into the high schools to try and attract the best, the brightest, the top students into their STEM discipline, into their programs. So quite often students will be inclined to choose a program to go and study in their undergraduate university programs that meets the criteria, the definition for STEM. So this is really interesting, just to have a look at the number of graduates. So graduates across universities in a number of different countries in 2020. And you can see the amount of STEM graduates that are coming out of China and India in particular. Now, obviously, this is also related to population numbers, but nonetheless, you can see that the attraction of STEM disciplines for young people, young school leavers in particular, in China and India, is exceptionally high. So there's something within that STEM definition that is really attracting young people to go and study in these courses. And of course, nursing doesn't come into that conversation at all at the moment. And so by the mid 2000s, China had actually passed the USA in the number of PhDs, specifically in STEM, being awarded. And it's expected that this year, 77,000 PhDs in China will be graduated compared to only 40,000 in the US. So it used to be that the US graduates in STEM and PhDs in STEMs was higher, but you can see how it's starting to change. So what do the general population think about STEM? I've already mentioned that the STEM program leads have been very good at getting into the high schools and letting students know about their STEM programs and their STEM disciplines. And the public also seems to favour education that is based in a STEM discipline. The perception is, and you can see by the other side, the truth is that actually STEM professions get paid more than non-STEM professions. People believe that if it's a STEM discipline, it attracts the brightest and the most qualified young people. That people who study STEM are actually more respected. But they also acknowledge that it's not, as it can be more difficult to get into. But also what I found really interesting is that they say that STEM disciplines make a meaningful contribution to society, slightly more than non-STEM disciplines, yet the next item says that STEM is less focused on helping people. And of course, I think that dichotomy there is really important for nursing, because we do make a meaningful contribution to society, and we are very much focused on helping others. But you can see how views around that helping of others flips, and they see STEM disciplines as being less concerned about helping others. And I'm not saying whether or not that's true. I'm just presenting the data. But what is true is that regardless as to the level of where you are in your career, if you graduate from a STEM discipline, you will earn more money at many, many different levels of when you exit your university program. So, is nursing a STEM? Now, if we were able to do voting with this, I would love to do a quick vote to see what our audience thinks. Well, let's just take a little closer look about nursing and how we define nursing. Now, this year, many of us, actually over 7,000 nurses around the world, went for the 2025 International Congress of Council of Nurses Congress. So there was over 7,000 nurses there. And at that conference, the ICN presented a new definition of what a nurse is and also what nursing is. Now, the last time that the definition was made available was, over 20 years ago. So it was very outdated. And I was quite pleasantly surprised, actually, when I read this document, because they started to move away from quite often the femininity and the what would be classified as the art and the caring nature of nursing. I'm not saying they're not important, but there's different ways we can describe that important part of nursing. And really, on that first paragraph, when you open this document, it has the words of a profession requiring scientific knowledge, ethical standards, and therapeutic relations. So put all those three together, and I think that really starts to raise the bar of the definition of nursing and the perception that the general population, our colleagues in healthcare, and also ourselves can start to have a more positive or a more modern description and narrative of what nursing actually is. And then the document goes on to move away from nurses not just being at the bedside, although that's an absolute core part of a nurse, but also how nurses can shape policy, have comprehensive roles in innovation. Disaster response was quite heavily focused, and population health. So I didn't agree with everything that's in there. Of course not. It's a very difficult thing to get right and to please everyone. But having this right up front in those first couple of pages, I thought, okay, something's happening here. Something's changing, and it's a good change. So if you think 23 years ago when the last definition was published, many nursing courses were still based in the hospital. Not all of them were a degree level qualification. So you can see that the ICN has moderated the definition to reflect, the training and the education and the science that is involved in nursing practice. Okay, well, there we go. Okay, so let's have a look then. Do we think nursing and STEM are aligned? Well, if we start with examples from education, to come into nursing, our students already need to have a prerequisite in anatomy, biology, and other science-related topics that they would gain at high school. But it's quite obvious that the science, we in our educational programs, we cover all of these topics in depth. It enables the nurse to do a viable health assessment to identify illness and disease, and importantly, to implement evidence-based interventions and practice that are based on the science of nursing. Technology. Well, all of our students now need to learn computer-based technology because everything's electronic. Use of equipment and machinery, for example, telemonitoring, dialysis, IVs, remote symptom monitoring. The list goes on as to how we have to educate our nurses around technology. And it's the same with engineering. Health and nursing informatics go hand in hand. Monitoring devices, wearable techniques, et cetera, understanding different codes within the hospital system. And of course, mathematics, drug calculations and drug administration, blood gas analysis, biochemistry, statistics, teaching our students how to read a research paper and to understand the statistics that are presented in those papers. We can't do any education in nursing without applying the S, the T, the E, and the M. Now, I want you to think back to that definition of STEM that I gave in the first couple of slides. And the definition is that the program has to apply one or more of the different disciplines of the STEM. Now, it's quite clear to me on this slide that nursing doesn't include just one. It includes all four. It includes more than the four. Okay, what about practice? Well, I've got quite an extreme, being an ex-ICU nurse, I've got quite an extreme example here. But, you cannot safely look after this patient and monitor and you'd safely attend to all of this equipment without applying the S, the T, and the M, and doing it at the same time and multitasking. But importantly, and what brings that therapeutic relationship part of nursing that is now prominent in the ICN new definition of nursing, is that there's a patient in the middle of all of that digital technology, all of that science, technology, engineering, and mathematics that is surrounding this patient is a person. And that's the person and their family that the nurse will develop a therapeutic relationship with and attend to the personal care needs of that patient during that shift as well. eye care, mouth care, and other personal care, skin integrity. You know, skin integrity, we're not just turning patients and making sure that sheets aren't wrinkled because it's, you know, that's what a nurse does. We're doing it because it's based in our evidence. It's based in our science. It's based around the science of skin integrity. And that's what we learn when we're in university and when we're in practice. It's part of our education. Okay. What about research? Well, all of our academics conduct research across many of these different areas. They apply science, technology, engineering, and mathematics in many of the interventions that they're developing and testing, whether it's focusing on patient outcomes and safety, health promotion, chronic disease management, symptom management, exploring health disparities and equality and how can we improve that, and of course digital health and informatics. The list goes on and on. I've just picked out probably some of the most common associations that you would probably make when you're thinking about the type of research that nurses frequently do and how that fits within the STEM definition. And of course, all of this falls under evidence-based nursing practice, or even just evidence-based practice, because we work within the multidisciplinary team. So you can see at the center of the STEM definition, and I mentioned in the definition of STEM earlier, it's about solving problems, and that's exactly what nursing practice is also about, and the research that we do. It's about solving problems, whether it's at the individual patient level, a family level, a community level, or a population and public health based level. We're all about solving a problem, but we do it based on the basis of the STEM definition. Okay, so why does this matter? Well, I've already spoken a bit, haven't I, about access to funding, including education and research. Recruitment opportunities, I've mentioned that also. But also, I think it's important because I do think that sometimes when we try and describe what a nurse does, when your family or friends say, well, what do you do? I think, and I struggle sometimes as well, is how do I actually answer that question? Because nursing is so vast. There's so many different parts to nursing. But maybe if we could identify within the definition of STEM, it might help us to create that narrative and to place what a nurse does or what we do in our practice, or if you're an educator or you're a researcher, it can help you to create that narrative that really is based in the foundation of a STEM definition. And I think it matters because nursing is a logical fit. And I can't see why nursing would not be accepted as part of a STEM definition. And I've provided examples from practice, education, and research. And I'm sure people online have many, many other examples from your own work and your own practice and that of your colleagues. So why is it so hotly debated? Because we're not recognised as a STEM in many universities, by many governments who set all of these different quotas. So why is that? And I'm not quite sure. I don't think anyone potentially really knows the answer to that. But I do think, and this is all published literature from some nursing leaders, for example, Professor Patricia Davidson from Australia has written a wonderful editorial a number of years ago now about STEM in nursing. And she put some pretty strong views forward as to what some of the challenges are and as to why it's hotly debated. So she points out, as do other scholars, is the image of nursing. And I think because sometimes struggling to find that right narrative is that quite often we do focus on what people see as the soft skills. You know, we quite often refer, and I think we still teach this, in undergraduate programs is that nursing is a soft skill and it's about science and art. Okay, great to have the science in there, but I do struggle with what's the definition of art here? Developing therapeutic relationships so that we can deliver the science in a compassionate way, so that we can do it safely. I understand that, but I really would like to see us move away from the definition of defining nursing as a science and an art. Very happy to have that debate. We do struggle with a gender bias where, at least 80% of the female population. And so, of course, that brings, a lot of, positive circumstances, but I think it creates more barriers. There's lots of reasons for that. I think, women are more likely to have caring responsibilities. So it may be sometimes that women's career has to pause, and that can, hopefully it's a lot better now, but I know that biases still exist around that. We do suffer with sexism. You will still often see and hear politicians describing nurses as angels, that going into nursing, the Prime Minister of the previous Prime Minister, well, there's been a few actually, it was a couple of Prime Ministers ago, Rishi Sunak actually, described nursing as a calling and as angels. And I just don't think that does us any favours. But it's up to us to take ownership of our own definition and to take control of that narrative. And we have to make sure that we're describing ourselves in a positive way. And of course, nursing is very hierarchical. A lot of healthcare systems are. And in some ways, that has to be the case. But also in some ways, I think, it can hold things back as well. And quite often nurses will tell me themselves, and student nurses, that they feel that they're at the bottom of the hierarchy compared to medicine and allied healthcare professionals. But why is that? Why do nurses often feel that they're at the bottom of the hierarchy? I haven't got a slide here to show it, but nurses are actually the most trusted profession in the world. That comes across time and time again. So actually, we should all be working as equal partners in decision making and in patient care, and moving away from this hierarchy. And I think professional confidence as well. I think the gender bias, the sexism, and the hierarchical structures can sometimes, create issues around how confident the profession can be in putting the importance of what the nursing role is forward, and having that debate amongst ourselves as to how we do that. But medicine is recognised as a STEM, and so are some allied healthcare professionals in some regions. For example, health and occupational safety is also identified as a STEM. Medicine have taken complete ownership of it, and in the UK, they've added an extra M to include STEM medicine. I'm not sure I quite agree with that approach. You either fit the ST and M or you don't. And I wouldn't want to see nursing go down the avenue of putting an N at the end. So STEMN for nursing. I think if the profession, the discipline fits the definition, then you stay as a STEM discipline and you don't go adding additional numbers on. But anyway, that's what doctors in the UK, in some of the literature seem to have done. And I think this just really tells the story that without STEM, we as nurses would not be able to provide evidence-based, scientific and innovative practices to our patients, or undertake research to develop and continually develop nursing science. So what's happening in Hong Kong and PolyU? Well, the Hong Kong SAR government a number of years ago launched a program to attract top scholars to come to Hong Kong and to work in Hong Kong universities. they wanted to attract 100. So it's been quite a successful program. It's attracted world-leading scholars across all of the STEM disciplines, and you can see there's pictures there. You might note mostly of men, but there are also female awardees, but STEM is still pretty much heavily dominated by male scientists. But before I arrived in Hong Kong, it was quite a while beforehand, the Dean, Professor David Shum, and Angela Chan, who was the interim head of school, contacted me to say, look, would you put an application in for a STEM professorship? And you know what, to be honest, I thought, what are they talking about? You know, nursing isn't identified as a STEM. How can I put a narrative together so that my research work fits within the STEM definition? And I did a literature search, found Patricia Davidson's article and a few other articles talking about STEM. But actually, I realized there's actually a bit of a global movement around this, especially in the USA, because it has real implications for money and visas in the USA if you are allocated a STEM discipline. So I was pleasantly surprised to see some of this, but I still couldn't see any real examples of where a nurse had actually been allocated as a STEM professor or given the title of as being a STEM nurse. So I had to think outside the box and create a narrative around my work that could fit the S, the T, and the M. And actually, I found out that, to be honest, it wasn't that difficult at all. And obviously, I put my application in, and the second week that I was here, it might have been the first week, I can't remember, the dean called me to say that I was successful. So I'm still the only nurse to be awarded, and I know that there's a current call out at the moment for another round of STEM professors for Hong Kong. So the only nurse awarded, but it would be fantastic if we could get more nurses onto this program. It comes with a significant startup package because you're relocating to a different country, a different healthcare system. So it comes with a startup package to create a team. And at that point, I was also able to apply for funding to set up the lab, the STEM lab, from the Hong Kong Jockey Club charities. And I was successful in gaining that as well. But you can imagine the application for my STEM lab was very different to many of the STEM professors that you can see here on this slide, because most of them are working in wet labs, because that's usually the definition of a STEM professor. So I think my lab was probably a lot cheaper because I just needed lots of desks and lots of computers that could do high-level statistical analysis. But anyway, that was successful as well. So this is how I situated my research around the S, the T, the E, and the M. So my research work is around mostly remote symptom monitoring for cancer patients who are on active treatment, either chemotherapy, radiotherapy, or a combination. And the remote symptom monitoring system that I developed and led at the Christie Hospital in Manchester in the UK was very much set up to provide early detection of potential toxicities of patients when they're on active treatment. And we've also moved into late toxicities as well, so monitoring symptoms of patients who are in survivorship and seeing if we can, through their symptom reporting, pick up if they've got late toxicities from late effects of cancer treatment. So obviously this means, from a science perspective, I needed to demonstrate the science around symptomatology, around cancer treatments and toxicity, how you can use the EPROMs to develop personalized pathways and develop evidence-based interventions for those symptoms. The technology part was based around developing the computer-based technology. How can we get the EPROMs that patients are reporting remotely at home linked into the electronic health record, and developing a digital platform to enable that to happen? And the engineering is around the computer programming for that, the informatics, adding monitoring devices and wearables to test different digitally enabled interventions that we were developing to also help patients self-manage symptoms at home. And of course, the mathematics, because a lot of this work is all around patient-reported outcomes, so questionnaires, my PhD was largely based on advanced psychometrics and using rationalysis. So I had the mathematics in the proposal as well, because of needing to translate and validate questionnaires in the Hong Kong and China mainland context. And of course, when you're collecting all of this data remotely from patients and it's automatically linked to their electronic health records, you start to develop really big data sets. And at the Christie, we now have over 100,000 individual EPROM responses from about 40,000 individual patients who have submitted EPROMs. So you can imagine this gold mine of data that we have, where we can link patients' reports of their symptoms, so the person, with all of the clinical data that we're collecting routinely as part of their medical care, bringing all of that together and starting to develop some really big predictive models and decision trees around survival, types of treatments, and starting to predict whether or not patients are likely to have to stop their treatment early because of toxicities. So that's all really exciting. So it's about translating all of that into the Hong Kong and China context. So what this is now showing is that, you know, we, as I said, we are collecting so much information and data from patients, a lot of nursing notes, your observations, if you're working in the hospitals, when you're taking patients' observations, it all goes into this electronic data set, and it all gets used and manipulated into big data sets for prognostic modeling. Now, I know you can't see that figure very clearly on the right-hand side, and I don't want you to. All that is showing you is a number of AI algorithms that have been approved from the FDA, all based on clinical data that's coming from electronic health records or coming from other big data sets to help with diagnosis of stroke, recurrence of relapse of diabetes, et cetera, et cetera, et cetera. And what my application for the STEM professorship focused on was, you know, well, how can we use all of this data? And there's another example here that is purely based on genetics, genetic data set, which helps to predict survival of cancer patients and final treatment planning for patients on chemotherapy. But what my application and my work asks is, well, where is the patient in all of these algorithms and in all of these big data sets? And people will say, well, of course they're in there. We've got their genetics. Look, we've got their RNA, you know, we've got their DNA. We've got their white cell count. We've got their blood pressure. We've got their weight. We've got their smoking history. But I still say, where is the patient's experience, which again is where nursing science comes in. So what my work is doing is looking at the collection of patient-reported outcomes, quality of life and symptom reporting, amongst other things, and integrating that patient experience into these different data sets. And I'm not showing the data here to you now, but we are now getting some interesting results coming out of the Christie data set, showing that when you include EPROMs or patient-reported outcomes into these prognostic models, the EPROMs, the patient's reports of their symptoms and quality of life, significantly enhance the prognostic models. So they are adding additional value to the prediction of whether or not someone is likely to complete their cancer treatment or predicting their survival. So also at PolyU, one of the reasons why I came to PolyU is because I knew that the School of Nursing was very much advanced in a lot of what the STEM definition is all about. So we're very proud that in the past 3 years, 3 of our undergraduate students were shortlisted and awarded a Hong Kong level InnoTech Awards. So 2022, 23 and 24, we've had our students winning these awards. So you can see what's written under each of those students is the innovative technology that they have developed and created, and actually gone on to develop companies, startup companies, and get patents. So a lot of this work, what I've just explained about my STEM professorship, a lot of our undergraduate students are already hungry for this. You know, these are our future leaders. You know, they want to be part of the STEM. They already are part of the STEM. They're winning STEM awards, competing with students from engineering departments and other STEM recognized disciplines. So I think they're telling us something, is that they want this narrative to also develop. Miss Mac on the end there actually is actually leading a program now to help us develop a scholarship or a fellowship for undergraduate nurses here at PolyU. And we're just getting ready to launch with our first year students. We're really, really excited about this new initiative. So we're riding on the back of all of the STEM work that's already going on in the school, my STEM professorship, our previous students who have won the STEM awards, plus we also already have really cutting edge infrastructure. My lab, which is the only nurse-led STEM lab in Hong Kong, called Digital Oncology Care Enhancement, DOSE. And we also have the Centre for Smart Health, who are also leading the way in lots of different AI technologies. So we're just getting ready to launch this with our first year students. We have a set quota, because it's going to involve quite an intensive course for students to engage with a mentor, to start to enrich and to introduce them to different STEM aspects. And the plan is that the students that take part in this STEM professorship in the School of Nursing will be in a very strong place to apply for many different awards around technology and development, because we want to mentor them to develop new technologies while they're an undergraduate, and you know, use it as a way to kickstart their ideas around different innovations. So we're very excited about that program, and we think it's very unique. So I'm going to conclude now. So in summary, I think, you know, not just nursing at PolyU, but I think nursing everywhere, you know, we have a real opportunity, because, you know, this isn't unique to me, to nurses at PolyU. Lots of our colleagues are already engaging in digital and technological innovation. We already teach all of the ST, the E and the M in our undergraduate programs and beyond. So I think we have a real opportunity to look at how can we create, you know, a different enhanced STEM narrative for nursing. So I really welcome people's comments and thoughts around this. Thank you.